All right. You're welcome back to today's presentation. The next topic is about therapeutic drug monitoring. So, without wasting time, I want to invite the next presenter. Please welcome her with a round of applause, please. All right. Thank you very much.
Thank you, sir. Good morning, esteemed lecturers, colleagues, and fellow students, and our viewers all over the world. My name is Dauda Shukrat Opeyemi, a final year pharmacy student. So I am honored to present on this topic, fascinating and interesting topic in clinical practice, therapeutic drug monitoring. So this therapeutic drug monitoring is very, very important because it helps the healthcare providers to tailor drug therapy to individual patients by measuring particular blood concentration and testing for therapeutic range. So stay with me as we dive into this topic. So I'll be emphasizing on the core principles of therapeutic drug monitoring and then the applications and how we can apply this therapeutic drug monitor into manage like all these narrow therapeutic drugs that have narrow therapeutic index and also to improve overall patient outcome. So by introduction, therapeutic drug monitoring, it is a clinical practice that involves measuring drug concentration in biological fluid, typically blood, to maintain a constant concentration within a therapeutic range. So it involves measuring biological fluid, but it's majorly blood plasma, and serum to detect the state of drug after a drug has been administered. So the drug there is a need for the drug to be monitored in order to ensure that the required therapeutic range of the drug is consistent in body to avoid overdose, to avoid toxicity or subtherapeutic. So TDM, that's therapeutic drug monitoring. It has historical roots in the 1960s, initially introduced to guide the use of anti-epileptics. So before it was majorly used for all these anti-epileptics. So that was around 1960s. So now it's incorporated in other aspects of drugs like antibiotics, some anti-hypertensive, and some drugs that have a very narrow therapeutic index. So stay with me as I go and study the core principles of therapeutic drug monitoring. So therapeutic drug monitoring is grounded in key pharmacological principles. So there are some principles that form the bedrock, the foundation of therapeutic drug monitoring. So understanding these principles, it is critical. So understanding these principles is critical for interpreting drug levels accurately and making informed decisions on dosage adjustment. So if you understand all of these principles that I'm going to be talking about, you will know how to make an informed decision related to individual patient, specialized need of the patient. So the number one principles in TDM is the pharmacokinetic and pharmacodynamics property. So pharmacokinetic, so we know it to be the study of what the drug does to the body, what the body does to the drug, rather. So what the body does to the drug in terms of absorption, the body will absorb the drug, distribute the drug, metabolize it, and eventually excrete it. So the other one is pharmacodynamic, which has to do with what the drug does to the body, the receptor, the enzymes, and some reactions, physiological processes that take place in the body. So all these principles, they are very, very important when we want to tailor drug therapy to an individual patient. So our knowledge of pharmacokinetics and pharmacodynamics, it is very, very important, because if you have the knowledge of absorption of drug, you know how a drug is absorbed, you know whether there is a variation in absorption pattern in different patients. You'll be able to know that, okay, maybe there will be a delay when a drug is given to this patient and another patient is receiving the same amount of drug. So you know, your knowledge of pharmacokinetic will make you to know that there could be variation in the way they absorb the drug. So they are very, very important. Another one is how drug is distributed in the body, the distribution pattern of drug. So the volume of distribution is very equally important to determine the concentration, the steady state concentration of drug in the body. So all these principles they are the bedrock and foundation of therapeutic drug monitoring. So another one is how drug is metabolized in the body. We have some people that they are fast acetylators, and then they metabolize drug. We metabolize drug faster than others. So it's all of this. They are very key. They are key aspects in therapeutic drug monitoring. And another one is excretion. So there are some factors. Maybe if somebody is have a renal impairment or any impairment in their normal organ, it can either prolong or accelerate the drug in the body. So all of these principles, they are very important when we are talking about therapeutic drug monitoring, because we want a positive outcome. We want to receive the maximum reports and effect from the drug we are giving to the patient. So we are looking at enhancing and maximizing the therapeutic effect of drug while we are minimizing the toxicity of drug. So another key principle, another key principle of drug therapeutic drug monitoring is the therapeutic range. When we are talking about the therapeutic range of a drug, so it represents the concentration window within which a drug is expected to be effective without causing toxicity. So the level between that range, it can denote that a drug is subtherapeutic, and a level above that, it can denote that a drug is toxic to the body. So it is very important. It's a very key principle in therapeutic drug monitoring, knowledge of the therapeutic range of the drug. You know that, okay, maybe at 5 milligram, this drug will be able to achieve its maximum effect, and at this highest dose, maximum dose, any this milligram is going to cause a toxic effect. So the knowledge of therapeutic range of each drugs that we are administering to patients is very important. It is very important when we're talking about therapeutic drug monitoring. So the third principle of therapeutic drug monitoring here is the steady state concentration. Steady state concentration and the half-life. Steady state concentration. So achieving a steady state concentration where the drug's intakes equals its elimination is essential for accurate TDM. The concentration when you are receiving, when a drug is being administered, the same concentration of the drug is eliminated from the body. So in order to maintain a regulated, a consistent concentration of the drug in the blood, in the body, so that the effectiveness of the drug will be achieved. So another one is half-life. Half-life of a drug is also an important principle in therapeutic drug monitoring, knowledge of the half-life of a drug. So which is the time taken for a drug concentration in the blood plasma to decline to half of its original value. When a drug is administered, maybe in the morning, maybe in the next 1 hour or 2 hours, the drug will disintegrate will decline to half. So if you know that, okay, this drug, the half-life is faster or is shorter, it will help us to know that, okay, this is the best time to introduce the next dose. So all the knowledge of all of this, they are very important in therapeutic drug monitoring. Another key principle is the sampling time and the frequency. Sampling time and frequency. The time you take the sample, it is very important when we are talking about therapeutic, because when a drug, when a dose is introduced to a patient, so at that time, the peak serum concentration all the processes, administration, absorption, distribution. So the time we take the sample, it's also very important. The level of the drug concentration but has declined. That's not the best time to know the concentration of drug. So the sampling time and frequency, it is very important. Another key principle here is individual variability. So individual, we have different body system, even genetics and other factors that cause variation in the way we our body metabolize, excrete, and process drugs. So inter-individual variability. So we have to adapt our drug therapy to individual patients, personalized patient care. So the kind of care you give to this person can be varied from. So depending on so we should direct this course of study on individual regimen. So without wasting much of our time, I want to go into the indications and the application of therapeutic drug monitoring. the application and indication of therapeutic monitoring. So it is widely used across various therapeutic areas, especially where medication requires precise dosing to avoid toxicity or subtherapeutic effect. Its clinical use is based on the drug pharmacological profile, patient-specific factors, and the therapeutic context. So number one here is one of the drug system that we apply this TDM is anti-epileptic drugs. Anti-epileptic drugs like phenytoin, carbamazepine, and valproic acid, and the likes of them. So it is very, very important because these drugs, they have a narrow therapeutic ranges. And then the significant interpatient variability. So TDM, it is very important we apply TDM is very, very valuable in managing this kind of drugs. So because the patient, they respond to the body and to the drug differently, and also it has a very, very low therapeutic index. So we are trying to minimize toxicity and then get the therapeutic value. Another application of therapeutic drug monitoring is the antibiotics. So it is also critical in managing aminoglycosides like gentamicin, neomycins, and then some glycopeptide like vancomycin. So where the therapeutic efficacy and toxicity are concentration dependent. So the level of efficacy you will get, the level of toxicity you will get, it is dose dependent. So it is very, very important we monitor the concentration of the drug in the blood system. So it is we can say that therapeutic drug monitoring is very valuable in this kind of antibiotics in this situation. So it also plays a role in managing multi-drug resistance, infections, and optimizing therapy in clinically because even in all these drug resistance, antibiotics resistance, if therapeutic drug is put into concentration, it can help to even prevent all this resistance because you will not be having a sort of resistance is subtherapeutic prescription. So they are not using the enough concentration of the antibiotics to be able to eliminate or kill the microorganism. So the knowledge of this therapeutic drug monitoring, it will help us to eradicate and prevent antibiotic resistance. So another application of therapeutic drug monitoring here is the immunosuppressant. The immunosuppressant like cyclosporine, like sirolimus, everolimus. So they are all these ones they are using organ transplantation, during graft versus host when a new organ is being transplanted into another individual. So the knowledge of this therapeutic drug monitoring, it will help to prevent organ rejection because you know the right dose, you know the therapeutic range of the drugs you are administering. Another applications of therapeutic drug monitoring that I have here is psychiatric medication like lithium, tricyclic, anti-diamethylphenidate, and co. So this therapeutic drug monitoring is used, and the lithium, it has very therapeutic index, lithium. So and the level must be regulated to avoid toxicity. So particularly in patients with renal impairment, some patients, they already have a dysfunction in their renal, in their kidney that will excrete the drug. The drug may stay longer, and some of them have big dysfunction. So we have some drugs that they induce the liver, and some they inhibit the liver. So all these factors, they can either cause toxicity or delay or cause subtherapeutic effect. So another application here is anti-cancer agent, managing cancer. So TDM is very, very important. So targeted agents such as methotrexate and bufam, they often require therapeutic drug monitoring. So methotrexate, for example, it can lead to severe toxicity without adequate monitoring. If you don't monitor the concentration very well, it can lead to toxicity. So another important application of therapeutic drug monitoring is antiretroviral and anti-tuberculosis. So in the treatment of HIV and tuberculosis, so TDM can help to overcome challenges related to resistance, drug-to-drug interaction, and variable absorption. The last application of TDM about here is the cardiovascular drugs, like the digoxin. So it is very, very common to have a very low narrow therapeutic index. Because if you exceed the the required dose, it can just cause a complication, it can lead to death or anything like that. So therapeutic drug monitoring, it is very, very valuable in this area. So I, without wasting much of our time, I want to talk about the integration of pharmacogenomics with TDM. Pharmacogenomics. So it has to do with the study of genetics, because variation, we have variability in different individuals in terms of genetic that influence how we process drug, how we metabolize drug. Even some people, they're in the presence of all these cyclotron, CYP450. So all of these factors. So I think it is very, very important before therapeutic drug monitoring is considered. They should also look into genetics, test of genetic properties, so that they will be ensured that, okay, the required earth that is required for a particular patient is given to them. So in conclusion, therapeutic drug monitoring, it plays a crucial role in optimizing drug therapy, particularly for drugs with narrow therapeutic windows. And it ensures that patients receive the correct dose, maximizing the risk and the adverse effect, while maximizing the therapeutic effect, minimizing the risk and maximizing the therapeutic efficacy. So, however, challenges like analytical difficulties, sampling, and all of these, access to all these equipment, that all these analytical procedures that are required for the analysis TDM. So there are also a challenges. So I think the future researcher, they should look into all of that. So advances in technology, particularly in pharmacogenomics, point of care testing, artificial intelligence, all of these point of care tests and all of these, they will help the health provider to be able to make their work easier, to be able to individualize drug regimen to particular patient. So in conclusion, therapeutic drug monitoring is an indispensable tool in modern clinical practice. As the field continues to evolve, the integration with emerging technologies will further revolutionize patient care, leading to safe and more effective drug regimen. Thank you so much for listening.
Wow, wow, wow. Please, I didn't hear that. I didn't hear that. All right. Thank you very much. Thank you very much for this wonderful presentation. Again, I sat down like a student, listening to my student teaching me. I'm impressed. I'm impressed. I don't know. In fact, they had nothing to say. In fact, I don't know. I don't know what I should use to qualify what she did to this topic. And everything was in order. The timing, everything. Thank you very much. Thank you very much. This is an academic exercise, and the only thing I can say is keep it up. 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 That's the only thing I can say. And our viewers, please, if you have any question, feel free to drop the question on the comment section. Any question,